Daniel, I'm going to be talking about Optimel and dry eye. Now, it is my pleasure to be invited here today by Dr. Toyos and Dr. Tedesco to talk to you all and also to hear the amazing talks from the other people in this field. So, what is Optimel? Optimel is a drop that we use in Australia for every single patient that we see. It's because it is so powerful and it's honestly the go-to drop that we use. It is proudly Australian made. And just like you guys in Italy, you've got your Ferrari, your Lamborghini, we've got our own Optimel in Australia, so we're very clever about that. We've got a CE mark across Europe, so it's been sold in Europe, and its active ingredient is Manuka honey. Now, what is Manuka honey? Manuka honey is a honey derived from a plant called blepharitis. That's this over here. And it is prized for its higher than average antibacterial activity. It's higher in antibacterial quality compared to your average standard honey. On top of that, it's got these other anti-inflammatory, wound healing, and antioxidant effects as well. So it's a sweet history about honey, pun intended. So honey has been documented to be used in ancient Egypt for more than 6,000 years. This is a hieroglyphic of an ancient Egyptian having some man-made structure to derive the honey from to use for food and for medicine. So when the medicine is used for 6,000 years, surely it means that it's been effective and it's been used correctly for these treatments. And the big man himself, Hippocrates, has been using it. He has documented using honey for his applications of his eyes and also for skin diseases as well. So I want to focus a little bit more about the antibacterial effects of this honey that we use in Australia. So there's a study, I want to emphasize, this is not a study on Optimel, this is a study on honey in general. And they compared honey versus gentamicin, which is an antibacterial eye drop. And they did it on guinea pigs this time, and what they did was they cut an incision in the conjunctiva of these guinea pigs. They put in Pseudomonas aeruginosa, or they put in Staphylococcus aureus, so a gram-negative and a gram-positive. And what they did, they compared these guinea pigs with either gentamicin or the honey. And clearly you can see there's a big difference between the treated zone with gentamicin and the honey. So the honey resolved in about 5 days, whereas the gentamicin resolved in about 6 days. So they're actually quite kind of comparable. And those ones that were under control, that are not treated at all, they were not resolved for more than 14 days. So there is some antibacterial effect of these honeys. Let's focus more on a bit on why is this antibacterial. And it's mainly due to the weak organic acids present in the honey. Now, weak organic acids are naturally found in the honey due to the flowers that it's derived from. And this honey leads to a lower pH. This pH level makes it really hard for the bacteria to grow, and hence is antibacterial in nature. Other reasons why it's antibacterial is probably due to the high sugar content as well, but honey is not very well understood because there's so many compounds in honey, so more research is needed. So now that we know that it's a bit antibacterial in nature, one would think, would it be applicable for anterior blepharitis? Since blepharitis is mainly caused by bacterial overgrowth or biofilms in the eye, as well as Demodex. So this study did just that. This is a human study that showed the difference between Optimel versus conventional therapy. So Optimel here, conventional therapy was, in this case, a warm compressed, lid massage, and a standard lubricant eye drop. And they found that in this 8-week study involving 114 participants, that total eyelid marginal bacterial colony counts reduced significantly with Optimel eye drops, but not the other treatments. So this shows some promising data that Optimel can be helpful for blepharitis. So once you reduce the bacterial overload of the lids, that would naturally decrease the inflammation of the eyelids. Now, I want to focus a little bit more on inflammation, as it is something that we try to treat holistically in our clinics. I want to raise your attention to raised MMP9. We've already talked a lot about inflammatory biomarkers in this conference, but this is something that we haven't talked about yet. MMP9 is matrix metalloproteinase 9, is a non-specific biomarker for dry eye and also for inflammation across the whole body. It is mainly the way it works is that it degrades the extracellular matrix and then more specifically the type 4 collagen in that layer. And then what it does, it paves the way for angiogenesis or growth of new vessels into that area, so like telangiectasias, that growth of new telangiectasias in that area floods that area with inflammation. So clearly, this is not something that we want in the eye. So chronically raised MMP9 across the whole body leads to all these diseases. So it's associated with cardiovascular disease, rheumatoid arthritis, uveitis, even cancer metastasis, as it leads to that angiogenesis of those vessels growing into that cancer. More interestingly, Sjogren's syndrome, it was found that people with Sjogren's had 3 times the amount of raised MMP9 compared to your average person who doesn't have Sjogren's. So the study found that dry eye patients had about 40% of them had raised MMP9 levels, and the control, only 6% had raised MMP9 levels. This is a statistically significant difference in two, and it shows that it's probably worth investigating more. This same study showed that raised MMP9 correlated with corneal staining, worse myopic quality, and also shorter T-breaker time, and they're all significant here as well. So, now that we know that MMP9 is probably something you want to lower in your eye and across the whole body in general, does the Optimel eye drop, does the honey eye drop lower that in the eye? So that study by et al. Found that for the people with raised MMP9 levels, there was a huge drop in the levels from baseline to week 8 after using the Optimel eye drop. So look at this massive decrease here versus conventional treatment. Conventional treatment, there's almost no difference at all. I'll just like to remind you, conventional treatment is the warm wrestling massage and a lubricant eye drops. So this decrease in the MMP9 levels and inflammation in the eye likely is the reason why they found better myosin secretion. You can see here the myosin is poor quality here. Here it's coming out clear. And you might be able to appreciate there's a little bit less red on this side after week 8 of using Optimel versus before. And these patients generally rely on eye drops much less. On average, these people here using Optimel are using eye drops about 2 to 3 times less compared to the people who are using just the normal eye drops. So, another study echoed these results. They found that OSDI and tear evaporation rate improved significantly with the Optimel honey eye drop. You can see the OSDI scores improved by 20 points after only 28 days of use, and about 10 points decreased with just a control eye drop. And tear evaporation rate decreased, so improved by 10 points in the Optimel group, and actually worsened a little bit or no change at all in the control group. So it is effective in improving symptoms and tear evaporation as well. So I want to wrap this up with talking about a case study that I had. This is a case study with a severe OSDI 45, which is very high. She had 8 years of dry eye, rosacea, red lips. You can see there's Demodex there as well, collarettes, crusting. The lid is very swollen. This telangiectasia is very dilated. And she's tried up cycling, artificial tears. She had IPL with a dermatologist. She's restasis for 5 years. That's a long time. And yet, she's still getting this OSDI. She's seen 5 ophthalmologists and they haven't really been able to help her in this case. We put her on this management system, IPL and meibomian expression. Talked a lot about that stuff already. Dietary modification, we followed the Toyos dry eye diet as well. This time I advised her to use Optimel 98 because it's a gel, more thick, and just apply it along the eyelash margin here, just to provide that extra help since she had a lot of blepharitis. And also obviously to wash the face and eyelashes more thoroughly in the shower or when she's washing her face between them. And this was what we found 2 weeks later. It looks a lot better. So it's still a little bit red, but all that stuff has gone away. And this is 4 weeks later. There's a huge improvement in OSDI from this point on. Just 4 weeks later, you can see that huge improvement there. You can see it more clearly in this comparison between side-by-side images of 4 weeks and baseline. This is a huge difference, and this is why we recommend these drops here. The most important thing here is probably the telangiectasia that's pronounced, and also the thickness of the lid. It's quite thick here, and it's more flat and even on this side, which is amazing. So in conclusion, just some key takeaways. So IPL is extremely helpful. That's why we recommend it to everyone. It's long-term and long-lasting. People require less eye drops overall, and also it improves the margin quality and also improves the patient's symptoms, the OSDI score. That's why we use it for every patient, unless they have some allergic reaction to some pollen or honeys in the body system. So that's it. Thank you for listening.